Hey, thank you for everybody for joining us today. I am Heather Florio, the CEO of Desert Harvest, and today we have Callie K. I'm going to say Krajcir. I am so bad.
Right, sure, you're good.
Krajcir. And she's here to join us today to talk about her nutrition plan, her books, and her entire process as a registered dietitian and an IC warrior herself, the process and methodology that she's utilized to help herself and many other interstitial cystitis patients. So thank you, Callie, for joining us today.
Yes, thank you for having me. I'm excited.
Yeah. So why don't you start telling us a little bit? Let's start with the beginning. Why don't you tell us your IC story?
Yeah, so in a brief nutshell, I have always had pain with urination that started as far back as I can remember. So as a kid, I was in pain every single time I used the bathroom, to which it got to the point where I thought that was completely normal and that everybody did that. I kind of just went through my teenage years up until age 18 and didn't say anything to anyone. I pushed through the pain. And I mean, at age 18, that's when I started to start asking questions about what was going on in my body. I started to realize this isn't normal. I went on Google, I made appointments, and I eventually got diagnosed with IC after I had already self diagnosed myself. I feel like a lot of us have done that.
Yeah.
And over the next few years, when I was in college, I was kind of shuffling through different doctors, different treatment options. I was looking for that quick fix. I talk about this a lot on my social media. And after a few years, I got to the point where nothing was helping me. None of the procedures, the medications, anything that my doctors were offering to me was helping. And that's because I truly believe that's because my mindset, I was looking for a quick fix, a magic cure, and I was overlooking the things like diet and educating myself and managing my stress and doing that like hard work. And once I started to address those things, that's when I started to see some relief in my pain. And over the next few years, fast forward, I'm now 27, I'm about 95% pain free. And I recognize that stress is my biggest trigger. And we all know that is something that is a little difficult at times to manage. So that's still a work in progress. But I became a registered dietitian a few years ago and just kind of went the clinical route. And I knew in the back of my head, I always wanted to help other people with interstitial cystitis because I personally struggle with it. And years and years ago, I joined like a Facebook Live like this, and I learned that there was only one dietitian who specialized in IC, like basically in the whole world. And I was like, okay, that is what I want to do with my career. And so the pandemic essentially pushed me out of my other job and got me to take the jump and start my own business. And that's kind of how all this started. That's how Callie K Nutrition started. I'm now specializing in interstitial cystitis. We're coming up on, I think, 3 years. And I've worked with almost 100 clients now and have seen the power of addressing the full picture, the full IC puzzle, like I call it, not just looking at, um, diet or stress or pelvic floor dysfunction, not just looking at one element at a time, but looking at the full picture. And that's kind of my story in like 3 minutes.
So you mentioned the IC diet. This is the first thing that we're programmed to go to. This elimination diet. This idea. Tell me your thoughts on that.
Yeah. And back when I did an elimination diet in college, it was an absolute train wreck. I didn't know what I was doing. Um, Now that I am a registered dietitian and I understand it a little bit better, I have learned that there is this big misconception in the IC community that the IC diet should be followed forever because a lot of us are getting that diagnosis. The physician is giving you this IC diet handout, but they're not really giving you an explanation on how to implement that into your life and you know time frame. How long are you supposed to follow that? So a lot of people are assuming, because they weren't told otherwise, that they are supposed to follow that long term. And what I have learned is that that IC diet was created and is meant to guide an elimination diet. And what that means is we all have our own unique diet sensitivities. Some people don't have any diet sensitivities, some people have a lot. And the gold standard for identifying what your body is uniquely sensitive to is to use that IC diet to guide an elimination diet. And what that process looks like is you kind of break it down into three phases. So a baseline phase, an elimination phase, and a testing phase. So essentially for about a week, you track everything that you are doing. So eating, drinking, your bathroom habits, your symptoms, tracking everything without making any diet changes, just so that we have baseline data to compare to as you go along the elimination diet process. And then anywhere from 2 to 4 weeks, the following 2 to 4 weeks after that, I have my clients do about 3 weeks is the elimination phase. So that's when you would be following that IC diet. That if you're thinking of the three column one with the bladder friendly, the try it, and the caution items, you would be eating off of that bladder friendly column, trying to eat as much variety as possible. We want to make sure we're not causing any sort of nutrient deficiencies or anything like that. And then after that, you go into a testing phase that can last anywhere from, I don't know, 2 to 3 months, depending on the person. And that's when you would introduce things back into your diet one at a time so that you can evaluate what your body's response is to that item. And we also want to know, if you're sensitive to something, can you consume that item in a certain amount? Or can you have it once in a while? We want to know those things so that we can improve our quality of life, because we live in a food centered society and we also want to increase confidence. So that's kind of what the process looks like.
So when you're eliminating one of those foods, or you've eliminated and now you're reintroducing one of those foods, and how long of a time period are you saying to essentially give that introduction before maybe you try the next one?
So we do in my program and with my clients, we do a 3-day testing period. So on day one, you do a very small amount. And then day two, you increase that if you have no symptoms. And then on day three, you do whatever a full size portion would look like for you. And then you would take a resting period between, so 2 to 3 days, because there are certain people who have delayed response times to
Mm-hmm.
certain foods. So we want to make sure that we have like a washout period between, and then you can move on to the next item. So that's kind of how I do it.
And then you mentioned nutritional deficiencies, and that we can really get easily nutritionally deficient on the elimination diet. So what do you see there with an IC patient? The typical struggles, that type of thing.
I see people developing a lot of stress and anxiety around eating, some food fear, and that can cause people to get stuck essentially in that elimination phase that I just talked about, where they're eating like the same 10 to 12 foods
Yeah.
every single day. And when you're not eating variety in your diet, there's a lot that can kind of go wrong if you're not really paying attention to it. So that is one of the main risks. And we also see a lot of like weight changes, like unplanned weight loss due to those reasons, and that can be dangerous.
Yeah, we've seen that a lot. We have a lot of customers that have come to us, and they're like, I only eat white foods. That's like, I eat rice, I eat pasta, I eat potatoes, I eat, and the food fear is so heightened. So I can definitely see.
Yes, and it's it's sad because we isolate ourselves usually when this occurs. It's like everywhere you go socially, there's alcohol, there's, tomatoes, there's soy when you go out to eat. So it's like you're always on edge, or you're just removing yourself from the situation completely. And then, that has a lot of mental impact.
Yeah, I almost think a lot of the people too, it's like indulge and deal with it later. I've seen a lot of that too.
For sure. Taking like a medication like pre-leaf or something like that.
I do
Just
that to myself all the time. Unfortunately, I'll go have drinks with the girls and then I'll come and then I will know, I'll be like, this was not a good idea. But you're hanging out with your girlfriends, you're having fun. And then it's like, so I go home, my go-to is I pop an extra dose of aloe that night because I'm all like, I know what's gonna happen the next morning if I do not do this. So
yeah, I think coming off the holiday season, there was more of that than usual because there's family that's peer pressuring you, or maybe you want to hang out with your old friends and they want to go for drinks. It's like, it's
yeah.
hard.
It's hard to be like, oh no, I can't. My bladder won't allow me to go do this with you. Or they order a bottle of wine for the table and you're out for dinner and wine is definitely a huge trigger for me. So
Yeah.
I've learned that over the years. So what is one of the most like common mistakes that you see when trying to kind of manage your diet for IC? What are
I I go back to getting stuck in that elimination phase.
Okay.
I see people getting stuck in that for months to even years, where they're just eating that same group of safe foods that they know won't hurt them. And they're afraid to kind of step out of that regimen. And it's understandable because if you have this list of things that could potentially hurt you, you're not going to be motivated to do that. And then it's just really tough, I think, mentally and emotionally having that fear in the back of your head. I also see people who may not necessarily be sensitive to an item stress
Mhm.
themselves out so much that they end up triggering a flare anyway. So
Just from the
it's like
stress.
lose lose.
Yeah, yeah, there's no winning there. So let's go into a little bit of my world. Supplements, vitamins. Let's talk about which ones that you see for patients are the most bothersome.
Yeah, so the two biggest ones are going to be vitamin C and vitamin B6. And they're both a little different. So when it comes to vitamin B6, it seems that at least in the research and the studies that have been done, most of which I believe were surveys, but people seem to be bothered more by supplements for B6. So that's why I always encourage people to do your very best to get your B6 from food sources if
Mhm.
possible. Um, and then vitamin C, the ascorbic acid, I always get the two forms mixed up. So correct me if I'm wrong, but the ascorbic acid version is the more bothersome version of vitamin C. And there's actually a less acidic version called calcium ascorbate. Is that correct, Heather?
They're both very similar, and they're both very similar, and they're both the difference is with the calcium ascorbate with the ascorbic acid. They're very similar in their names, and they're both sourced from the same places. And the problem also is with vitamin C. Many times it's when you get to the whole food versions of vitamin C, they're
Yeah.
supplemented from foods that are typically bladder irritants. And so highly acidic food, citrus foods in a lot of cases.
Mhm.
And so in this case, for instance, what Desert Harvest does with our buffered vitamin C is we utilize calcium. Gosh, why am I? We're buffering it out with the calcium, and we specifically do that specifically because, and we use the calcium carbonate, and we utilize that in our aloe too, specifically because that's the best form at buffering out acidity of things. And so in our aloe, we're trying to buffer out as much acidity as possible. And in our vitamin C, we're adding the calcium to kind of help, additional calcium to help buffer out that acidity. Now, obviously, it's interesting, as you talk about stress responses and things like that. even with this, we still have people that are so fearful that even when they take it, no matter what, they get that stress response. And and you have to go in it knowing that we've processed it the right way to make it. This would be the same, like the on brand name that you typically see in a store would be like an ester C. That it's a brand that's also been around for a while as well, that also buffers out with calcium to buffer out the acidity. We do use the calcium ascorbate version, which is going to be very similar to your ascorbic acid version, and same sourcing. It's just needs that buffer to make that possible. So.
Mhm. Exactly. And then just reviewing food sources for the listeners if they prefer to try for the food sources before they go to a supplement. I see friendly sources of vitamin C would be red and green bell peppers, broccoli, cauliflower, spinach, potatoes, blueberries. Those are all pretty good sources of vitamin C. And then vitamin B6 would be things like fish, chicken, whole grains, legumes, cashews, even almonds. So those are some good food sources. And um, I always try to recommend going for the food first. And then if you're still
Yes.
falling short, then that's when a supplement can help.
Yeah, that's where it makes the most sense. Like, for instance, our B complex without the B6, there are multiple things that are happening in there. We take out the B6 because not only is it a bladder irritant, but it's so readily available in foods naturally, and we get so much of it naturally in our diet that deficiencies in B6 are not that much of a concern. And
Yeah.
then it also affects gene mutations, that many people with gene mutations actually can't have the B6. So that's another problem. And then we also utilize the methylated forms of the B9 and the B12, because those are easier for your body to process than the typical folic acid. So people think, oh, I took this when I was pregnant, I needed large doses of it, things like that. But folic acid is actually really hard for your body to process. And so this becomes a gentler way with the methylated forms. And that's kind of why we do that specifically with the B vitamins. Another alternative to vitamin C, if you're looking at for it for kind of an immune support, interestingly enough, during COVID, this became really popular. We couldn't even make it fast enough, was the quercetin, interestingly enough, because it serves as a multifunction. So it's going to have your mast cell activation, it's going to reduce that, but it also has an immune support function, that was readily studied during COVID because they were using high doses a lot in hospitals, different things like that. So it ended up being readily studied. And it's funny because back in the day, we used to make this, and this was, going back to the 90s. And it used to be when we first started sourcing this, we could only source it once a year because we had to take it and turn it into a capsule, or we could not preserve it for the rest of the year. We literally had to go from harvest to manufacturing to creating. And so we'd have to like guesstimate how much we need for an entire year and hope it was correct. And if it'd been 2020, we would have been screwed. But with how many people wanted that because of the COVID research coming out. But now we have a way in which we can kind of freeze dry it and preserve it and keep it throughout the year. But just interesting factoid about that one. But that can be an alternative to vitamin C now too. So.
Yeah. That's so interesting.
Yeah. It's just weird little factoids. 29 years of doing this. It's funny, the history. So, as we're talking about supplements, when we're talking about nutritional deficiencies, other things like that, what are the top 3 supplements that you recommend?
Um, Top three, I would say the best, like we can call it insurance, would be like a multivitamin. And I know that you guys have one that has that buffered vitamin C, right?
Yep, and the B6 removed from it as well.
Right. And I love the quercetin. I think that's a really awesome supplement. And then also I mean, more so for IC. I know that aloe has really great nutrition in it, but I think that that is probably the top thing that I will recommend to people who are suffering from IC. And it's not just because I'm talking to you right now, it's actually what I recommend.
Yes. Well, thank you very much. Yeah, I mean, this is why we develop these products and different things, and there are various forms. The one thing about the multivitamin is that you can get it's low acid. That's very critical. There's only a couple of these like this on the market. Quercetin is starting to become more readily available as a result of the COVID. Most times we use aloe vera to act as a carrier to make it more systemic. And this is going to be great if you have a mast cell activation component to your interstitial cystitis, where if you're taking a Benadryl, a hydroxyzine, things like that. This is going to this has flavonoids in it, but many times what you'll see in health food stores is you'll find quercetin with bromelain in it acting as the carrier. We're utilizing aloe vera, which is why you don't see bromelain in ours. And then, of course, the aloe vera capsules. Now, this is a specialized compound. This is not the aloe vera that you go into the health food stores and get. We have a unique patented process. We've isolated compounds. This is why this is so unique about how we process it and what we've been doing this for interstitial cystitis for 29 years in our research. But yes, as you mentioned, it does. I mean, it has great immune properties already naturally because it's got antimicrobials, antibacterials, antifungals. There's over 200 nutrients in the aloe vera plant, and 75 of them are active nutrients. And so you're already getting so much supplementation naturally with the aloe. That's why I always say start there and then see what you need to add, because you don't need to take unnecessary products that your body doesn't need, because it's just going to waste it out, and then you're spending money on nothing because it's just going right through your body. And so it's really critical to know, meet with a dietitian like you to understand your deficiencies, what you are eating and are eating. Potentially speak with your doctor about getting a panel. The science, they're really good at doing things like B12, testing your B12, your D, your vitamin D levels, other things like that. But interestingly enough, the science is very tenuous. You'll see kits where you can test and see which vitamins your body needs, but unfortunately the science isn't really caught up to that theory or idea. So it's more of a marketing ploy. So just understand that those kits that you get and you say, you should be taking vitamin C, or you should be taking that. The science really hasn't caught up to that. I hope that someday it would. It would be great for us to be able to, and we're headed towards that, towards DNA, where we can go in and say, I'd like a blood test so that I know what I need and I don't need. And they're actually doing it in Canada right now with the cannabis. Health Canada is working on it, genetically mapping which strain you need based on condition, based on your genetics, how much dosing you need, different things like that. So, I mean, there are a lot of these great innovations going on, but what's there right now, it's really kind of listening to your body in a lot of cases, or looking at your diet with your nutritionist and determining where your holes are, where your deficiencies are, so that you can supplement. Not everybody needs a multivitamin. It's an easy all-in-one, and I know that, but not everybody needs that.
Yeah, exactly. And just a side note, based on what you were just saying,
Mm-hmm.
same thing goes with food sensitivity testing. They're so trendy right now. I just walked in a Rite Aid and there was one like right next to the cash register, and the science just isn't there yet for those. It's
No.
easy to want to do that because it seems simple and it seems like it'll save you time.
Mm-hmm.
And really, what we're at right now is to just do the elimination diet if you feel it is an appropriate time for you to do that. I mean, it's not for everyone. So if you have a history of, let's say, an eating disorder, it would not be appropriate If you're able to, like you said, work with a registered dietitian or even a doctor to help you through that process, that's even better.
Yeah. And that really is, because it helps you, guide you on the journey. They can use the science that is there to help support some of it, and then the other parts, they can look at your diet. You can do food diaries. You can find these nutritional deficiencies in your food diaries, and just mapping this out with a clinician like you is very important. So one of the things I think that we didn't talk about, I'm looking at my notes here. So we were talking about I think the only thing we didn't go into is how can you, if you're also, let's say you're having to follow other diets like the FODMAP diet, you've got other, because we know that so many IC patients have other comorbidities, other conditions in addition to IC in a lot of cases. So how do we balance when we have multiple diets that necessarily we may need to follow?
Yeah, so a common question that I get asked is, if you have both IBS and IC, can you follow both the IC diet and the low FODMAP diet at the same time? And the short answer is, yeah, you could. Now, do I recommend doing that? No, that's going to be extremely restrictive. And all those things, the risks that we talked about earlier, would just essentially be doubled. So I have had a few clients where we've had to prioritize one over the other. So for example, if your IC is the more like the priority, we could go through and do the elimination diet for the bladder irritants. And then after that, we could transition into looking at doing an elimination diet, looking at those FODMAP items. And it's actually interesting. The low FODMAP diet and the elimination diet for IC, the process is very similar. So that is a really great thing to know. But there are also dietitians who specialize in IBS, and that's all that they do, similar to me only doing IC. So if you can find somebody that can help you through that process, that would be the safest option.
Okay, perfect. Yeah, and it looks like we've got someone on here that's trying to watch their gluten as well. I don't know if it's celiac specifically, but that's probably another common occurrence is potentially a gluten-free diet and/or
Yeah,
vegetarian, vegan diets, other things like that as well.
I just saw the questions. I didn't even realize there were questions.
No, I just found them myself.
Oh my gosh. Okay. Do we want to dive into that?
Yeah, let's dive into this a little bit. So, one of the things that ask you, and I think this might lead in very well to the is drinks. So we were talking about drinks and IC friendly drinks. You have a cookbook for this, right?
Yes. So myself, my support dietitian, her name is Beverly Levesque, and one of our clients, her name is Carrie Cole. She is like the best IC friendly cook ever. We created two different e-cookbooks, and one of them is focused on mocktails and also party snacks or appetizers that you can bring to social events. And I think it's important because when you get the IC diet handout, it's like, okay, what can I have? What can I drink? And so, I mean, besides water, you could try things like herbal teas, maybe like a marshmallow root or a chamomile tea. You could try coconut water, but making sure that it doesn't have citric acid in it because brands love to put citric acid in everything.
Yeah, like aloe juices.
Yeah, exactly, exactly. And so that's kind of why we wanted to create a mocktail book, is because there weren't many options out there that were both alcohol free and bladder friendly. So we have, I forget how many recipes we have in there, but it is quite a few. And they also just like look really pretty and they taste good.
Ah, that's even better. Tastes good is good. Sometimes you can get these like specialty, cookbooks, and you're like, this is cardboard. So,
Exactly.
so one of our questions we have here, Gail has asked, is Vitamin K, okay.
Vitamin K seems to be okay. I haven't seen any research or anyone saying that they have issues with it. I think that kind of gets with the potassium sensitive, or
Mhm.
we're talking about vitamin K, we're not talking about potassium.
Yeah, we're talking about vitamin K, but
Vitamin K, yeah, no.
lead in. Yeah,
No.
I have not heard of anyone specifically isolating over the past 29 years vitamin K as a
Yeah.
bladder irritant problem. But if you have overlapping comorbidities, it could be coming from something else potentially. So maybe.
Mhm. Good point.
I guess I'll take this question. How does aloe vera help with interstitial cystitis? So, in our double blind placebo controlled studies with Urology Wellness Center and University of Maryland, we found that it helped with pain, frequency, burning, and nocturia. How is the really good question we're trying to figure out. It has always been theorized that aloe vera naturally has what's called glycosaminoglycans in them. It's almost like a sugar. It's a sugar chain that is we're theorizing, and we're actually studying this at Wake Forest University right now, that it's coating the bladder. So imagine it, because the gag layer, the urothelial cell layer of the bladder, is what's typically impacted for an interstitial cystitis patient. So as a result, for bladder centric pain, and so as a result, we're seeing that we're studying that urothelial cell layer because it's theorized it's acting as a coating, so that then it allows the anti-inflammatory and analgesic action to have the function. And as things pass through your bladder, they're not irritating, affecting that lining, causing more irritation and issues. And but again, this is why we do this buildup effect. So everybody, many people go at the very beginning, 6 capsules a day, and it is very important to follow that dosage protocol. That has been researched many times over the past 29 years. We did a survey with the Interstitial Cystitis Association for grant funding. We've studied this in Italy with results that'll be coming out later this year. And it is very important to follow that dosage protocol for the first 3 months, because that we did a study for 6 months, but the longest it ever took a patient to respond was 3 months. And so as a result, we say follow that specifically for the first 3 months. And then from there, you can maintenance dose down, because if you are going to respond, you're going to respond within those first 3 months. And then let me see. We got lots of questions here, Callie. I don't
I
even.
love it. I love questions.
Um. Oh, this one. This one might be good for talking about. You have another cookbook, right?
Yes, yes. So we had a summer themed cookbook. Obviously, the recipes can be applied the rest of the year, but we do have a cookbook that does contain, over 50 summer themed, IC friendly recipes. We have appetizers, salads, like grilling options, desserts, some fun mocktails were also thrown into that one. So yeah, lots there. And then I do have some additional recipes on my website as well.
Oh, perfect. Okay. And we'll pop that website up here in a second again, too. Um, and this will be, we should bring up, this is a good one. So the IC Safe Diet, as far as the IC diet goes. Do you want
So
to
do you mean like which one should people be using? Because there are like two of them out there.
that is going to be my guess, is what she's asking. Where could she go to find the best version of this?
Yeah, so there's two that are probably the most popular. So one is on the Interstitial Cystitis Association's website, and what they have is it's kind of like a two-column IC diet where they tell you what the most common irritants are. So that's going to be things like alcohol, carbonation, tomatoes, all the things that we've been talking about. And then they also have a list that says the least bothersome items. So that can be helpful. And then the IC network actually came out with one that is that 3-column uh, list that has the bladder friendly, the try it items, and the caution items. And I think that both of the lists can be helpful. I think it just depends which one you want to use. Do you want to use a more general one that could be less restrictive, or do you want a more in-depth list to go off of? And so I think those are the major differences. I personally have my clients use the 3-column one, but I make some adjustments to it because there are some things that are more pro-inflammatory on that list that we want to remove during that elimination diet period. But that is my long answer. Did I answer that question, Heather?
I think so. What I am seeing is you're kind of creating a combination. So realistically,
Yeah.
I think we need a version on your website.
Maybe we can develop that. I think we definitely can. And I mean, I even occasionally will take it a step further. If somebody is having issues with histamine, they could look into like a low histamine type plan. Luckily, the IC diet is already pretty low histamine. And then there's other things occasionally that will pop up where, for example, if somebody is has celiac disease, we will do gluten free, or if they think that they might have a lactose intolerance, we could kind of tailor it to be lactose free. So it kind of, that's how we personalize things in our program that we have to each person individually. And it's because there is no one size fits all plan for everyone. We're all very different. Like I said in the beginning, we all have different sensitivities. And I see a lot of people who think they think they're sensitive to everything on that, caution column of the IC diet, when in reality they only have like 3 or 4 specific triggers, and they were just over restricting unnecessarily.
Yeah. Oh, and there we go. So they've got they just put up the ICA's diet right here on this site so that you can definitely grab that until Callie has hers on her website.
Yes, they have a lot of great resources on their site. So definitely check that out.
Perfect. And let's talk constipation. Okay. So constipation, do you want to start tackling it or?
Yeah, I mean, any sort of issues with your bowels, so whether it's constipation or diarrhea, can affect your bladder as well. I personally have IBS, so if I'm on either end of that spectrum, you best believe my IC is going to be flaring as well, and it is not fun. So, things to remember to prevent constipation is staying hydrated, trying to sip uh, bladder-friendly fluids throughout the day instead of chugging, at increments. Um, Being as physically active as you possibly can. It could be like a light walk, it could be yoga, it could be, whatever it is that you enjoy doing. We just want to get the body moving. And then fiber, we want to make sure that we are eating enough fiber. There's 2 different forms of fiber, but trying to add fruits, veggies, whole grains into your diet. Those are the basics of preventing constipation. And then something that I do when I am constipated, and I was taught this by a physical therapist, was doing the bowel massage. And it sounds really weird, but if you haven't heard of it, look it up. It is a game changer for me when I'm like kind of stuck in a bind.
Yeah, we actually review it in my book with Ingrid Harm Hernandez, The Musculoskeletal Mystery. So we go into constipation a little bit, as well as a full overview of pelvic floor physical therapy, including there's a portion on constipation specifically. My other go-to, of course, is our product, the magnesium, because I try to. Most of us are magnesium deficient just generally. And so I just try to keep a little extra magnesium. And we, Desert Harvest, we utilize the magnesium oxide form because it redirects water to the bowel just to keep the bowels healthy and moving. So that's kind of my big one. But I also travel a lot, so I'm eating on the go and traveling, and you may not necessarily get your full water intake, and so sometimes I have to up that dosage from my my couple a day, but just to help keep things kind of. So we've had a lot of people over those years that have used it for opioid induced type constipation, other medications that are inducing constipation. We have a lot of people that will use the magnesium oxide as an offset, which you can talk to your doctor about dosing, because there you can go all over the place with dosing. You know, it can be anywhere. I mean, I've seen as much as 9 a day for opioid induced constipation, and like I said, I do 2 a day just to have more magnesium in my diet, and to just always keep things regular, especially when I'm on the go so much.
Mm-hmm. Yeah, that's a really great supplement for that. I totally forgot when I was getting massage.
Yeah. Oh, and I guess this is a plug to say that if you're on taking calcium, you're doing any type of calcium, even the pre-leaves of the world, things like that, you need to be offsetting equal parts magnesium to equal parts calcium, because you will get constipated. So whatever milligrams of calcium you are taking a day, you should take equal parts magnesium, or you will get stopped up. And as we all know, that's uncomfortable and painful and hurts the bladder even more. It just creates overall more pelvic pain. So definitely make sure that you're balancing those two elements and equaling them out if you are supplementing calcium. So
Absolutely.
And then this one. The answer to this, Carrie, is no. You should not take aloe vera instead of trying the IC diet. I use the IC diet. I use the aloe to kind of. So when I talked about going and having drinks with my girlfriends and popping an extra dose, it kind of helps taper off what I know would be a flare the next morning, but it does not supplement the fact that I knew that food, and I now know my triggers. And if I had not done a diet with Callie, or learned how to what foods I should not and should not eat over the years, I would not have known to supplement that extra dose of IC, and I would have ended up in a flare, and then I would have learned. So this is very much about learning and your own diet journey, and learning that so that then you can better apply that in your life. The aloe vera is just a quick additional go-to to kind of help stave off if you've eaten one of those no foods, but not necessarily to supplement the IC diet, in my opinion. Thoughts?
Yeah, totally agree. Same thing with supplements like Prelay, for example. Like, that can be really helpful down the road once you know your triggers, but first you need to know what your triggers are. Otherwise, you're going to be taking it with every single meal that you eat, and that's not sustainable.
Well, and like interestingly enough, so we have the calcium glycerol phosphate, which is the same ingredient as Prelete, but we also have a calcium and vitamin D3. And interestingly enough, one can work better for someone than the other. And you talk about this not at the beginning of your journey. Learn yourself, learn your triggers. Then you can use this as an additional support tool after the fact. But interestingly enough, some people respond because a calcium glycerol phosphate is better at neutralizing acid in foods, whereas calcium and vitamin D3 more acts within the gut itself. And the acidity in the gut, and kind of keeping and helping with balance there. Whereas the calcium glycerol phosphate is particularly targeting the foods that you're eating, and targeting the food itself, not your bowels necessarily, and your gut. And so those are the two differences. And interestingly enough, like I said, one can work for another, and the other one, it's either one or the other. It doesn't seem that people like both. And at least we've seen over the past 29 years. So, All right, let's see what we have. Oh, Here we go. Oh, I believe I read in a study that the findings of Epstein-Barr virus and another virus, poly-K, found in urine cultures by C. I have not read this, Gail. Are you able to post a link to this? Um, it's interesting. We've been trying to isolate things in urine cultures of IC patients for a very long time. I know I think it was the University of Pennsylvania that was trying to do a study where they collected over years urine from IC patients from all over the country, and they still were not able to isolate a molecule, and a compound in the urine cultures that could denote interstitial cystitis, trying to be able to get us past this idea of having cystoscopy or diagnosis of exclusion, which are currently typically the two methodologies used most in the United States for IC. We all know if you've had a cystoscopy, very painful, not enjoyable whatsoever. Yeah. So, but unfortunately, interestingly enough, and this goes to two schools of thought, we have two different ways in which, in the world in which we're dealing with this. And really, I think diagnosis of exclusion has done a very large disservice to interstitial cystitis and interstitial cystitis research, because it has created a high rate of misdiagnosis, and as a result, we're working very hard. These amazing researchers are here in the United States trying to phenotype and create subtypes for interstitial cystitis. And recently, about a year ago, it was November 2021, at UCLA, they did a machine learning program that was actually, for the first time, Dr. Lenore Ackerman was actually able to dump patient data into an AI machine learning program that then was able to find three distinct categories. Some people had overlap, but many were isolated into only one category. So you had bladder-centric pain, the true IC pain. Your pain was coming from your bladder. And then you had like a neuropathic kind of pain that might be coming from, maybe a chronic back pain injury. It could be coming from other sources of the nerves being impinged, inflamed in some way. And then the last one is more of like a myofascial pain, muscular pain, which was 88% resolved with pelvic floor physical therapy. And so we've got this really kind of thing where we've lumped so many people. And interestingly, in Europe, they don't do that. They will only diagnose via cystoscopy, and there has to be true bladder wall impact, visual bladder wall impact for them to diagnose interstitial cystitis. So it creates an interesting flow. If I get to do research around the world, and I see all the different ways in which they're researching and looking at this. So it sounds like very similarly, they were trying to see if they could isolate something in urine cultures for IC patients, it sounds like, maybe in this study. So I would, Gail, really love to read it. If you do have it, definitely send it along. And then I might be able to speak better to that. So glucosamine and chondroitin. I can start by tackling.
Yeah, Heather, why don't you do this one?
So interestingly enough, there are very interesting schools of thought. So there have been several studies with glucosamine and the bladder wall, and the reason, and in chondroitin, in combination. The reason is there are glycosaminoglycans, just like in aloe vera. There are glycosaminoglycans in glucosamine and chondroitin. However, it's almost like it's an additional support tool in combination with something. It's not enough on its own or by itself. If you wanted additional bladder lining support for the urothelial cell layer of your bladder, you could add glucosamine and chondroitin. That is why we have it. Interestingly enough, if you're trying to supplement it for your joints, recent research came out that is very damning to glucosamine and chondroitin as far as it relates to joints. And interestingly enough, it actually showed that collagen is much more beneficial to the impact of our joints and joint health via the elasticity piece than glucosamine has been over the years. And most of the previous research has recently been debunked in regards to glucosamine as it relates to joint health. So interestingly enough, what we've always thought about it for, it's not as good for. But the way Desert Harvest sells it, we're selling it really to be an additional support to the bladder lining, because we do know that there is evidence that it does have a benefit, but as a standalone, it doesn't have enough benefit. Ah, there you go. I'll let you take this one, Callie.
Yeah, so we do know that artificial sweeteners are one of the more uh, bothersome items for people with IC. Obviously, as a diabetic, yeah, regular sugar is going to be an issue for you. So, for somebody like you, I would say you could essentially do a testing period, like a mini elimination diet where you go through and you test the different sweeteners out there and see how each one um, kind of, if any of them trigger you, because you might be fine with artificial sweeteners. You won't know until you test them one at a time. You might do better with one over the other, or like I said, you might be fine with all of them. Heather, do you have any thoughts on that?
I am anti sugar free in this sense because they all undergo some type of chemical process, other things like that. And always down the road, we have found some type of negative side effect related to some type of sugar free sweeteners in our diet coat, or whatever it might be. So for me, yeah, I completely avoid. If I'm going to have sugar, it's just very important to me. And a lot of the times when I have sugar, I just make sure that I'm utilizing raw cane sugar or something that then when I'm baking or when I'm doing something else, or if I want to add a little something to a cut, or I go to honey. So I actually put honey in my coffee some times because there's a certain type of coffee that I does not irritate my bladder. I have no problem with that, and so I'll add as long as it's not a dark roast type coffee, and so I'll add honey to that as my sweetener. I'll do the same things with tea, other things like that, because at least with the honey, you're also getting the antibacterial components. You're getting these additional benefits. So I try to think about my sweeteners from a raw natural source versus anything that's undergone a chemical process as far as it comes to my sweeteners. I mean, we try to do the same thing with our supplements and trying to find the raw, most purest form without adding a bunch of stuff to it and unnamed chemicals or whatever on the bottle. So.
Yeah, I think another thing would be, is it type 1 versus type 2 diabetes?
Yeah.
Are you seeing a dietitian? Like there's a couple other questions that I would have that we obviously can't address right now.
Yes, yeah. When we get into the diabetic conversation, that gets so much more cumbersome, and that really becomes an endocrinologist that really has to guide you through that process when we get into diabetic. Definitely interesting. Okay, you didn't. Yes and no. So what we recommend is because we don't know the etiology of what is causing, whether it's theorized that it might be autoimmune, but we haven't proven that. So theoretically, if it's autoimmune, once you get it back to health, how do you stop it from attacking again? And so for aloe vera for IC patients, this is where we kind of have recommended over the years kind of a maintenance dose. Everybody is a little bit different on what that maintenance dose, and we have a protocol on our website where you can, after those first 3 months, you can start working on finding what your maintenance dose is. And that's different for everybody. For me, I do 3 capsules a day. That's my maintenance dose. It works great for me. But we have some people that take 1 or 2 a day. We have people that alternate and don't take it all of the time, and just take it here and there. So it really, you're going to know your body the best, and you're going to be able to listen to your body the best. This isn't a cure. This is a bladder support piece that is, it's the IC itself is not cured. And so you definitely have to think about, especially because we don't need the etiology. And if it's autoimmune, it's just going to turn around and attack your bladder again if you don't have this protective coating in theory. And so we definitely do recommend a small maintenance dose, but it doesn't have to be the 6 capsules a day. It's, just a couple. So it's not any different than your other supplementation. It's got great immune support properties naturally. So, and it also is great just to take regularly because our aloe vera also has D-mannose naturally in it. And so D-mannose has been proven in studies to bind to E. coli bacteria, only E. coli bacteria, and flush it out of the system. So theoretically, you're getting an additional support piece, especially if maybe your etiology might be theorized to be related to chronic UTIs or something like that. Although we're only talking one type of bacteria at this point, but you do have that D-mannose piece naturally in the aloe. So, and then Callie, this one, take it away.
Can your food triggers change over time? So we don't have any research that confirms or denies this. I usually give myself as an example. So years ago, when I was in college, I couldn't have basically any of the caution items on the IC diet list. I would react right away. And as time went on and as I got my symptoms managed and minimized, I can consume all of the things on that list in moderation. Obviously, I can't go have like 3 glasses of champagne in a night, but I can have one once in a while. And so I find that as you get your symptoms managed, they can decrease. Although, like I said, we have like no research to go off of when it comes to this question.
Have you had people that have like popped up and then had suddenly new triggers where they've done the elimination, they've determined their triggers, and then later down the road a new trigger pops up?
Not really.
No?
No, nothing yet, at least.
Okay.
Yeah, it's very interesting.
Well, that's good to know. That once you kind of figure out the sourcing, you don't have to worry about it as much down the road once you've kind of gone through the process. So that's good.
Yeah.
Okay.
Yeah. Fruits that are IC friendly, the go-to would be blueberries, coconut, apples, and then there's a lot of, kind of try it items when it comes to fruit. So there would be, I would say things like bananas are going to be 50-50. Some people can't do them at all. Other people are fine with them. So that's going to be where the elimination diet will come into play and be really helpful.
Perfect. Probiotics.
Yeah,
I'm a little, so we sell a probiotic. But we only sell this one strain, and we do it on purpose because IC is theorized to be autoimmune potentially. It potentially a lot of comorbidities that are other conditions that IC patients have typically are autoimmune related in some way. And most probiotics on the market actually cause an inflammatory response. And so you're inflaming your condition essentially. And so we chose the Bifido if you do need a probiotic, which everybody doesn't. And this is the thing I strongly like. I don't tell everybody. It became very trendy for everybody to take probiotics. And then they're wondering why their gut health is messed up now all of a sudden, or their stomach hurts or different things. You may not need a probiotic. And this is a good conversation to have because we only sell this one because it's the only one that has been researched been proven to not inflame autoimmune conditions, Bifidobacterium infantis. And so that's why it's recommended by so many gastroenterologists, this particular strain is because of that. But if you don't need it, don't just get a probiotic because it's trendy or that you think you may or may not just to have good digestive health. Probiotics are for people who need it, and not everybody needs it. And those are my essential thoughts on probiotics.
Yeah, great thoughts.
Yeah. For pain, this is going to be so aloe vera, if you're talking about interstitial cystitis, the aloe vera capsules, the super strength aloe vera capsules, does have a response. Pain was one of the markers of response rate in the 87.5% of IC patients that responded to the Desert Harvest super strength aloe vera. However, we know, and you just talked about this, we want something instantaneous. We crave a quality of life back. We crave and so for that reason, for 5 years or so, we were researching CBD. And we did a study at McGill University that showed that it reduced bladder pain by 83% after 24 hours. And so this was very, very ideal, and this was actually quite amazing. We just introduced those results. So there is a positive response in regards to pain as far as that goes, for interstitial cystitis, specifically for bladder pain with a more instantaneous result. We did see it waned after about 72 hours. So it's something that is more instantaneous treatment, but not a long-term, necessarily maybe solution for everything. But yeah, so I do know we're hitting the 3:00 mark. I do know you need to go, Callie. So you've got, do we have the website or the info? You can email us at info@desertharvest.com. And we will be happy to get in. And if we missed you, I apologize. We were trying to get through all these questions. But if you do have any other further questions, either Callie or I will be more than happy to answer them. Just email over at info@desertharvest.com. Reference this Facebook Live event, and we'll make sure that the questions get answered ASAP for you. So thank you very much for joining us, Callie, and providing a wealth of information for everybody. And go check her out. She's helping a lot of IC patients. Diet is one of the hardest things to navigate for an IC patient. And for a little bit, you get a lot from her. And go check her out. Can't say it enough.
Thank you, Heather. Thank you so much for having me.
Yes, thank you. Go enjoy the rest of your day, everybody, and take care.